Millions sign up for ACA plans but never pay. A study finds lower cardiovascular risk with canagliflozin, and a Supreme Court ruling should make it easier to bring biosimilar products to the market. Welcome to This Week in Managed Care. I'm Laura Jost. A new report from CMS finds that nearly 2 million people who signed up for health coverage under the Affordable Care Act for 2017 had not paid premiums 2 months later. The Health Insurance Exchange's Trends Report found that those who canceled coverage or had it terminated were less likely to have financial assistance than those who paid on time. Those who failed to maintain coverage also had higher premiums. CMS Administrator Seema Verma said the report shows that coverage under the ACA is too expensive. Consumers are sending a clear message that cost and affordability are major factors in their decision to cancel or terminate coverage. A new study finds a lower risk of cardiovascular events for patients taking canagliflozin, the type 2 diabetes drug sold as Invokana. Long-awaited results for the CANVAS trial were presented Monday at the 77th Scientific Sessions of the American Diabetes Association in San Diego. A related study on renal function, called CANVAS-R, found a 40% drop in overall renal decline. The study's lead author, Dr. Bruce Neal, said the findings show the need to balance the benefits of canagliflozin against risk of harm for a subset of patients, including those with a history of peripheral vascular disease. Dr. Neal spoke with AJMC about the different groups of patients included in the CANVAS study and what the results tell us about the effect of canagliflozin on heart failure.
The program results are interesting because we did have this 1/3 of participants who were primary prevention. Of course, we don't have enough events to say, goodness, this was independently significant in primary prevention because we didn't power it to do that. What we can do is look to see, was there any evidence that it was different in the primary prevention to the secondary prevention? And we certainly don't see any evidence of that. So it's a positive first step, but we really want some more data. In terms of the heart failure piece, I think there's a lot of interest in this class for the management of heart failure because it clearly has a volume offloading effect, and that's probably a big part of why we see these early benefits with the drug. So I think patients who have got diabetes and are perceived to be at risk of heart failure are going to be really strong candidates for canagliflozin and other SGLT2 inhibitors.
For full coverage of the ADA scientific sessions, visit ajmc.com. Biosimilars will have an easier time getting to market following this week's unanimous ruling from the U.S. Supreme Court in the case Sandoz v. Amgen. Makers of biosimilars won on 2 key grounds. They don't need FDA approval to serve the branded drug maker with a required 180-day notice. They can opt out of the so-called patent dance, a series of disclosure requirements, without risking an injunction. The ruling is expected to bring lower-cost versions of drugs to the market faster and save health systems money. To learn more about the ruling and what's happening in this emerging healthcare field, visit the Center for Biosimilars. The American Medical Association has announced that an oncologist will serve as its president for the first time in 2018. Dr. Barbara McEnany will take the reins at AMA in June 2018. She is well known for her work with the Come Home Medical Home Project, which is funded by the CMS Innovation Center. Dr. McEnany is an advocate for the patient-centered oncology payment model, which she discussed in a recent article in AJMC's Evidence-Based Oncology. To read the article, visit ajmc.com. For all of us at the Managed Markets News Network, I'm Laura Jost. Thanks for joining us.